Good evening. You're watching a special edition of The Big Story. I'm Olivia Quay, coming to you live from the Straits Times newsroom. Now, Prime Minister Loong will address the nation on the COVID-19 situation in Singapore in a few minutes at 5 p.m. In his Facebook post today, PM Lee said that it's an uncertain and worrying time, especially with the number of cases in the migrant worker dormitories. He added that teams in the government are working hard to contain the spread in the dorms and look after the well-being of the foreign workers. And you can watch PM Lee's address live on this very channel. Now, Singapore reported 1,111 new COVID-19 cases as of noon today. The total number of confirmed cases here has passed the 9,000 mark, standing at 9,125. 20 of the new cases are Singaporeans and permanent residents. In the meantime, I'm joined by Professor Teo Yek Ying. He's the Dean of the Saw Swee Hock School of Public Health at the National University of Singapore. It's good to have you back, Prof. So we're 2 weeks into the circuit breaker. It's time for a report card. How have we fared so far, do you think?
So if we look at the case reports, the daily case reports over the past 2 weeks, we can see that the 3-day moving average, and this means the 3-day numbers, if you count from the second day, third day, and the fourth day for the circuit breaker, we had a high of an average of 48 cases during the first few days of the circuit breaker. In the past few days, this has dropped from 48 to actually 26 over the past few days. I haven't included today's number yet, but this shows that the circuit breaker has worked to some extent. However, many of us were actually expecting the figures to be lower, and it does show that there is still some degree of community transmission happening out there. And we have seen that the recent action in recommending McDonald's to close, as well as shutting down construction for 14 days, those are signs that the task force are still having the information that leakages are happening, especially amongst the essential service sectors.
Right, I see. Well, the foreign worker dormitories have been the focus these days in our fight against the virus. So what do you make of the current measures in place to reduce the spread in the dorms?
So let's look at what we have done in the dorms. We have tried to the very best of our ability to increase the spacing and distancing within the dormitories. We have actually pulled out a segment of the people into temporary housing, floating hotels, in stadiums and car parks, so that it's working to increase physical distancing. And we know from the experiences in China, in South Korea, in other countries, increasing physical distancing, minimizing the interaction between people as much as possible, those are the measures that will work. The challenge here is that the pool of migrant workers that we are faced with, 200,000, 300,000, those are very large numbers. And the dormitories, 43 of them, the initial setup, we have 12 to 20 people within the same room. That distancing will take time for it to be effective.
Well, do you expect the majority of the foreign workers who are infected to fight off the virus?
So I do see that amidst all the gloomy news that we are faced with daily, this is actually one of the better highlights, the better news that we can look forward to, which is many of these dormitory workers, migrant workers, they are young, they are healthy. So we expect that the disease will hit them in a mild way, in a much milder way than the elderly adults. But I must emphasize, it still means that we have to make sure we put in place the necessary clinical oversight to make sure that if for any migrant workers whose situation is getting worse, they are identified at the earliest possibility and the best care that is given.
Well, so sorry to interrupt, Professor, or we have to cut live to PM Lee right now.
We are now 2 weeks into the circuit breaker. On the whole, people have coped well. Most of us have played our part, staying at home, complying with the restrictions. We have adjusted to working from home and home-based learning. When outside, we wear masks and keep a safe distance from others. And we've kept to our immediate family units and avoided gatherings with extended family and friends. The number of new cases in the local community has leveled off to below 30 new cases daily. This is the result of the circuit breaker and all of us working together. But as you know, our total case numbers have risen sharply since the last time I spoke to you, just 10 days ago. Today alone, we have over 1,100 new cases. Almost all were detected in our migrant worker dormitories through aggressive testing. The large number of cases at the dorms is a serious problem. To assess the extent of the spread, we have tested aggressively, not only those who reported sick or showed fever or flu symptoms, but also those who were well and asymptomatic, not showing any symptoms at all. Almost all the migrant workers infected have, at most, only mild symptoms. This is not surprising, as they are generally young and thus much less likely to become seriously ill because of COVID-19. Our doctors, nurses, and healthcare personnel are working hard, triaging them early and taking good care of them. It is early days yet, but thankfully, so far, none of the new cases of migrant workers have needed supplemental oxygen or intensive care. We had one earlier case of a Bangladeshi worker who was in the ICU for 2 months. This was case number 42. We never gave up on him. Last week, his condition stabilized. He was transferred out of the ICU to a general ward. It will still take him some time to fully recover. With some luck, he should be able to see his newborn son soon. We hope that the situation in the dorms will remain this way, most of the cases being mild and very few needing oxygen or intensive care. All the major dorms are supported by dedicated teams of doctors and nurses. To protect the health of our migrant workers, we will step up the medical resources in the dorms. We will deploy more medical personnel to make sure that anyone with fever or flu symptoms receives appropriate and timely medical treatment. We will house the mild cases either on-site in a separate facility within the dorm or in community care facilities elsewhere. And we will make sure that those who need more active treatment receive immediate attention and can be sent promptly to the hospital to help them recover. We will also pay special attention to the older workers who are more vulnerable. We are preemptively moving them to a separate dorm where they can be monitored more closely. To our migrant workers, let me emphasize again, we will care for you just like we care for Singaporeans. We thank you for your cooperation during this difficult period. We will look after your health, your welfare, and your livelihood. We will work with your employers to make sure that you get paid and that you can send money home. And we will help you stay in touch with friends and family. Ramadan begins in a few days' time. We will make sure that arrangements are made for our Muslim workers. When Eid al-Fitr comes next month, we will celebrate with our Muslim friends, just as we celebrated the Indian New Year with our Indian friends last week. This is our duty and responsibility to you and to your families. Apart from the workers living in dorms, we are monitoring two other groups of migrant workers closely. First, workers who live in shop houses, private housing, or HDB flats. And second, workers in essential services. This group is still working during the circuit breaker, helping to keep Singapore going. Some are cleaning the HDB blocks or hawker centers. Others are maintaining key infrastructure, like our broadband networks. If these workers move in and out of dorms, they become potential channels for cross-infection in both directions. Hence, we are housing these essential workers separately. We are also testing them to make sure that they are healthy and to pick up any infections early. So far, the clusters in the dorms have remained largely contained and have not spread to the wider community. We will do our utmost to keep it this way. In the wider community, the circuit breaker is starting to have an effect. The number of community cases has fallen in recent days. This is a result of all of us coming together, making sacrifices, and adhering to the circuit breaker rules. But we cannot afford to be complacent. We must press on to bring down daily infections more sharply to a single digit or even zero, and to reduce the number of unlinked cases. Those cases where we do not know how they got infected or from whom. Because, unfortunately, that number of unlinked cases has not come down. And this suggests that there is a larger hidden reservoir of COVID-19 cases in the community. And this reservoir is the source of these unlinked cases, which we have not detected. I discussed this with a multi-ministry task force on the next steps to take. We want to bring down the community numbers decisively. We also want to make sure that if any leakage occurs from the dorms to the wider community, we can detect it and contain it early and prevent new clusters from forming and bursting out of control. To achieve these two objectives, we must all hunker down and press on with our tight circuit breaker measures. We have called on all Singaporeans to stay home, go out only for essential needs, like buying food or groceries. Otherwise, please stay at home. If you do need to go out, then go by yourself, not as a group or as a family. Even when exercising outside, do so only by yourself and only in your own neighborhood. Remember, it's not just about adhering to the letter of the law. The spirit of the guidelines is to reduce movement to a minimum and to avoid being out and about in the community. This is the way to protect yourself, your family, and everyone else. So I hope everyone can cooperate and do your part. Some hotspots, like some popular wet markets, are still a problem. Large groups of people continue to gather at these places, making it hard to practice safe distancing. These places will impose entry restrictions to thin out the crowds even more. You can do your part too. Do your marketing on weekdays rather than weekends. And don't bring your whole family with you for grocery shopping. When you run errands, go out alone, get what you need, and return home straight away. We will also close more workplaces so that only the most essential services will remain open. This will reduce further the number of workers keeping essential services going and minimize the risks of transmission among the workers. It will mean some degradation of services. For example, less frequent grass cutting in our HDB estates. But I hope we all understand why this has to be done. We will implement these tighter measures until the 4th of May. But we will not be able to completely lift the restrictions after that and go back to business as usual. We will therefore extend the circuit breaker for 4 more weeks beyond the 4th of May, in other words, until the 1st of June. Then, provided we have brought the community numbers down, we can make further adjustments and consider easing some measures. This way, we can be more assured that we've made definite progress and consolidated our position. Many will be disappointed by the extension of the circuit breaker, especially our businesses and workers who are hurting greatly. But I hope you understand that this short-term pain is to stamp out the virus, protect the health and safety of our loved ones, and allow us to revive our economy. The government will continue to help our businesses and workers cope during the extended circuit breaker period. We will provide the same level of support to workers and businesses as we are doing now. The ministers will hold a press conference immediately after this to explain the details. Saudara-saudari sekalian, sudah masuk 2 minggu kita menjalani langkah pemutus rantaian jangkitan COVID-19. Secara amnya, warga Singapura telah berjaya menyesuaikan diri sejauh ini. Sebahagian besar duduk di rumah dan mematuhi peraturan dengan bekerja dan belajar dari rumah. Dan tidak lagi menyertai keramaian dengan sanak saudara dan teman-teman. Juga memakai pelitup apabila keluar rumah. Saya tahu ini semua sukar, tetapi terdapat tanda-tanda yang menunjukkan bahawa kita telah mencatat kemajuan. Di kalangan penduduk Singapura amnya, jumlah kes merosot ke paras kurang 30 kes sehari. Namun, jumlah kes baru yang melibatkan pekerja asing di dormitory terus meningkat dengan tinggi. Ini adalah satu masalah yang serius. Kami telah melancarkan usaha besar-besaran untuk membendung situasi di sana. Mujur, hampir semua yang dijangkiti menunjukkan tanda-tanda jangkitan yang ringan. Kami akan melipat gandakan usaha untuk membantu pekerja asing. Ini termasuk menubuhkan lebih banyak pusat perubatan dan mengerahkan lebih ramai doktor dan pegawai kesihatan untuk menjaga mereka. Kami harus menjaga pekerja asing seperti mana kami menjaga warga Singapura. Kami akan menjaga kesihatan dan mata pencarian mereka. Ini adalah tanggungjawab dan kewajipan kami kepada pekerja asing dan keluarga mereka. Di kalangan penduduk yang lebih luas, yang membimbangkan ialah ada banyak kes-kes yang sumbernya tidak diketahui. Ini bermakna ada jumlah kes yang besar dalam kalangan penduduk yang belum dikesan dan merupakan sumber kes-kes yang tidak berkait. Saya telah berbincang dengan menteri-menteri tentang strategi selanjutnya. Kami sepakat untuk menurunkan jumlah kes dengan tegas supaya kami dapat melonggarkan langkah-langkah pemutus rantaian jangkitan dengan secepat mungkin. Kami juga mahu memastikan bahawa sebarang penularan jangkitan di luar kelompok pekerja asing boleh segera dikesan dan dikawal supaya tidak menular menjadi kelompok baru. Demi mencapai 2 matlamat ini, kami perlu memperketatkan langkah-langkah pemutus rantaian jangkitan. Ini akan dilakukan sehingga 4 hari bulan Mei. Ayuh, kita kuatkan azam sepanjang 2 minggu ini supaya memutuskan rantaian jangkitan COVID-19. Jika semua berjalan lancar, kami boleh melonggarkan langkah-langkah ini kemudian. Bagaimanapun, kami tidak boleh menamatkan sepenuhnya pada 4 Mei. Kami terpaksa melanjutkan pemutus rantaian jangkitan 4 minggu lagi sehingga 1 hari bulan Jun. Dengan ini, kita boleh jangkakan kemajuan yang lebih mantap dan baik. Pemerintah akan terus membantu golongan pekerja dan pemilik perniagaan dalam tempoh lanjutan ini. Saya harap anda semua dapat berikan kerjasama penuh anda. Bagi masyarakat Melayu Islam, anda akan menyambut bulan Ramadan minggu ini. Dengan masjid-masjid masih ditutup, Ramadan kali ini tentunya berbeza dari tahun-tahun sudah. Nampaknya, saya tak ada peluang untuk buka puasa bersama anda di masjid. Sayang sekali. Tetapi, saya difahamkan, MUIS, para asatiza dan masyarakat Islam kita penuh semangat untuk pastikan Ramadan tahun ini tidak kurang hebat dan bermakna. Banyak wadah dan bahan-bahan online disediakan untuk membimbing masyarakat Islam menjalankan ibadah puasa, membayar zakat dan juga membuat amal jariah, menolong mereka yang memerlukan. Banyak keluarga juga semakin mahir menggunakan teknologi untuk terus berhubungan dengan sanak saudara dan teman-teman. Syabas. Saya sangat menghargai pengorbanan dan daya tahan anda untuk mengharungi masa-masa sukar ini. Saya dan pasukan saya sedang berusaha memastikan setiap penduduk Singapura selamat. Inilah tugas paling penting kami. Kami tidak akan berhenti selagi matlamat ini tercapai. Bersama-sama, kita boleh mengatasi wabak ini. Terima kasih. 各位同胞，今天我想再次和各位说明冠状病毒疾病在新加坡的传播趋势，以及接下来我们必须采取的一些措施。我们是大约在2个星期前实行阻断措施，大致上国人都相当合作，留在家里，在家办公上课，也暂时没有跟其他家人和朋友聚会。这是不容易的。不过，大部分的国人都为了大家的安全，做出不同的牺牲和调整。目前每天平均出现20到30起新的社区感染病例，这显示阻断措施已经取得一点成效。谢谢大家的合作。如今，冠状病毒主要是在客工宿舍传播。政府非常关注客工宿舍的疫情，积极采取行动遏制病毒的扩散，确保客工得到妥善的医疗照顾。我很欣慰，许多社会团体和爱心人士都伸出援手，筹集善款和物资给我们的客工朋友，帮助他们度过这个非常时期。另一个我们需要关注的情况是，社区感染病例中还有不少患者与其他病例没有关联。我们不知道他们如何受到感染，或是和谁接触了。也就是说，我们的社区里可能存在许多还没有被发现或检测出的病例，这令人担忧。因此，我和政府跨部门工作小组进行了讨论，我国接下来 应该怎么做？我们只有2个目的：第一是让社区感染病例大幅度减少；第二是确保客工宿舍疫情受到控制，以及没有扩散到社区。为了达到这些目的，我们做了2个重要的决定。第一，我们将进一步收紧现有的阻断措施，一直到5月4号。我们将继续要求国人留在家里，除非需要处理必要的事情，例如购买食物或必需品，否则请不要出门。如果不得不出门，请戴口罩。同时，每个家庭在任何时候最多只能有1个人外出。我们也将加强人流管控措施，限制人潮较多的地方，如一些巴刹的人流量，让人们能够保持安全距离。同时，政府会暂时关闭更多工作场所，以减少员工之间的接触。只有提供最关键必要服务的商店、超市和工厂等能够继续营业。工作小组将在接下来的记者会上公布更多详情。我们希望这些新措施有助于大大减少社区内的传染。可是从目前的疫情来看，我们应该无法在5月4号达成之前预定的目标，完全解除阻断措施。因此，我们做的第2个决定是将阻断措施实行期延长4个星期，直到6月1号，以保障国人的安全。当然，政府明白这会对企业和员工带来一定的影响，所以之前所公布的援助措施也将延长。我们将竭尽全力与企业和员工一起度过这个难关。我要再次吁请国人继续与政府合作，特别是年长人士，你们的抵抗力较弱，其实我们的抵抗力较弱，请别出门，也别到处乱跑，要留在家，才能避免受到感染。有人说自己生病是自己的事，可是如果你生病了，把病毒传染给别人，那就是大家的事了。所以，请大家不要轻视这个病毒，认真对待以及遵守所有防疫措施，让我们都负起社会责任，保护自己，也保护家人。Let me conclude in English. You will naturally ask, where does this lead us? How do we exit from the circuit breaker? Nobody knows how long the pandemic will last. Most likely, it will take more than a year before effective treatments and vaccines become available. So we have to take things one step at a time. To exit from the circuit breaker, we need to do 3 things. First, we must open up incrementally, in small steps, making sure that we are safe each step of the way. This is what New Zealand and Germany are beginning to do, very cautiously. They believe that they have broken the chain of transmission, but they want to be extra careful. They don't want to open up prematurely after lockdowns, only to find COVID-19 coming back and then be forced to lock down a second time. This has happened in Hokkaido. We should try our best to avoid this. Second, we need to scale up testing for COVID-19 substantially so that we can quickly detect any new cases that pop up. This we are progressively doing, not only by procuring test kits and equipment from other countries, but also by developing and manufacturing our own test kits. Third, we will need to make full use of information technology, IT, so that when we discover COVID-19 cases, we can trace much more efficiently where they have been and whom they have been in contact with. We have the Trace Together app, and we are currently developing other apps for this purpose. For these apps to work, we will need everyone's cooperation to install and use them, like what the South Koreans have done. There will be some privacy concerns, but we will have to weigh these against the benefits of being able to exit from the circuit breaker and stay open safely. I know this has not been an easy time for everyone. We are making progress, but we have not yet succeeded by a long way. The results do show that the circuit breaker is working. Now, we all need to do a little bit more. Make best use of the next 2 weeks of the tightened circuit breaker and the 4 weeks of the extension beyond that. I ask for your support and cooperation. I ask for your trust and confidence. Let us go all out to beat the virus and break the chain of transmission. We will overcome this together. Thank you.
Prime Minister Hsien, who said the government will be extending the circuit breaker by 4 more weeks. That means that instead of ending on May the 4th, it will now last until June the 1st. Now, the government will then decide whether certain measures can be eased. We'll be crossing live to the National Press Centre to the COVID-19 Multi-Ministry Task Force.
To slow the spread of the virus, including the circuit breaker that we are living under now. But the number of new cases has risen sharply, due largely to clusters in our migrant worker dormitories. PM has just emphasized how we are looking after our migrant workers. There are signs that our measures are working in the wider community, but the numbers, especially unlinked cases, have not come down enough. We are concerned about undetected cases in the community causing further infections. This is why PM has just announced further tightening of measures for 2 weeks and an extension of the circuit breaker by 4 weeks to the 1st of June. The Multi-Ministry Task Force will share more details. Kim Yong will update on the overall situation and our strategy to deal with this phase of our fight against COVID-19, and Director of Medical Services Kenneth Mark will cover the medical aspects. Lawrence will give the details on the further tightening of measures and the lengthening of the circuit breaker, and Josephine will provide an update on the situation in our migrant worker dormitories. I'll now hand over the mic to Kim Yong.
Thanks, DPM. As of 12 p.m. today, there are an additional 1,111 COVID-19 cases in Singapore, of whom 20 are Singaporeans and permanent residents. We have seen a significant increase in cases in the past 2 weeks, driven predominantly by aggressive testing in the foreign workers' dormitories. While we are addressing the cases in the dormitories, are also monitoring closely the number of new cases in the community. Circuit breaker measures appear to have helped. Number of new cases in the community has decreased from an average of 39 cases per day in the week before to an average of 29 per day the past week. That said, the number of cases in the community remains a worry for us. What is particularly concerning is that the number of unlinked cases in the community has not fallen, averaging about 20 cases a day. We have also been picking up COVID-19 cases from our surveillance programs. This indicates that there is continued seeding in the community. Many of them undetected because the illnesses are mild, symptoms are mild, but they are still infectious. We are now at the midpoint of the circuit breaker measures. It is therefore very critical for all of us to put in extra efforts in safe distancing so that we can break the transmission and further reduce the number of cases in the community. We will also extend the circuit breaker period by another 4 weeks until 1st of June 2020 to give more time for the circuit breaker measures to take effect on the ground and to ensure we stamp out the transmission. Lawrence will give further details on some of these measures. On patient care, our key focus is to ensure patients receive appropriate care. We must pay particular attention to the more vulnerable patients, for example, our seniors, the older workers, and we must also do what we can to avoid fatality at all possible. Patients who are more severely ill will continue to be treated in our acute hospitals. Those who are clinically well may be cared for at our community care facilities. And I want to take this opportunity to thank all our frontline workers, especially our healthcare workers, who have come forward to work very hard and to care for our patients. And I also want to thank all our partners who have stepped up and partner us and offer their assistance in many of our initiatives and programs. I want to take this opportunity to also thank fellow Singaporeans for doing their part in practicing safe distancing. We know Singaporeans have been looking forward to resuming their normal activities, but we need to push on for the safety of everyone, especially the more vulnerable in our society. Let us stay the course and overcome this crisis as one people. Now I'll ask DMS to give an update on the medical situation.
Thank you very much, Minister. As of the 21st of April 2020, the Ministry of Health has confirmed an additional 1,111 cases of COVID-19 infection in Singapore. As Minister said, 20 of them are Singapore residents, Singapore citizens or permanent residents. And we are still confirming the count. At this point in time, provisionally 1,046 work pass holders who are residing in our dormitories. A more detailed breakdown will be provided in the press statement later today. We continue to see a trend where the number of imported cases has come down very significantly. On most days, that has been zero since the 10th of April. Of the confirmed cases that we have, and in total we have 9,125 cases. We have discharged 39 patients today, and 27 patients are in the ICU. We continue to look after them to the best of our abilities. The remaining patients are looked after in a variety of different settings, and that includes those who are in our acute hospitals, those who are nursed and looked after within our community care facilities, as well as in isolation facilities that we have designated and set up within dormitories. We have a small number of patients who are currently within private hospitals, and they are recovering while awaiting confirmatory tests before we deem them suitable and fit to return to the community. Efforts remain to provide further support for all our foreign workers in the dormitories. We've set up medical teams and medical posts that provide support for all our 43 purpose-built dormitories. We are also arranging for a system of medical support that would provide augmented cover for workers who are also accommodated in other settings, including factory-converted dormitories. This has been with the strong support of our regional health systems. And I wish to acknowledge also the contributions of volunteers who have stepped forward under our SG Healthcare Core initiative. Many of them have come from a variety of different settings, including from the private sector, and they work hand in hand with our staff in the public healthcare institutions in the front line, supporting medical, giving medical treatment to factory workers in dormitories. We also have a strong partnership with the Singapore Armed Forces, who have stepped forward to provide us with invaluable support in many different areas, including contact tracing, in the management of quarantine operations, in helping us to establish and set up many of the medical posts that we have, in helping us to establish swab and isolation facilities that support the work of the dormitory medical system, as well as providing strong leadership within the dormitories, working very closely under the auspices of the Joint Task Force with the dormitory operators to ensure that there is a proper system in place for isolation and segregation. And we remain committed to make sure that we provide the best support we can, treating all our foreign workers and making sure that they receive good care. We will continue to establish more capacity in our community care facilities to accommodate the foreign workers who are infected and who present to us. And we remain committed to making sure that our entire healthcare system can respond flexibly to accommodate the increase in needs on the ground. Thank you.
Good afternoon. As we all know, we are midway through the circuit breaker. We are already seeing some positive results, but we cannot be complacent, and this is the time now to continue to hunker down and give this a further push. So first, we call on everyone to do their part to minimize movement. Remember, the virus spreads through people, through our contacts with others, and when we go out and touch surfaces, and then our hands touch our faces. Yes, we can take precautions like safe distancing and wearing of masks, but the best way to beat the virus is to stay home. So if you need to go out to buy food, to buy groceries, go out alone. Don't turn this into an occasion for a family outing. And if you need to go out to exercise, exercise alone and in your own neighborhood. Don't travel out to exercise. So we call on everyone to do this because it is the best way to protect yourselves and your family members. Second, we will continue with our efforts to control people movement in popular areas like wet markets and supermarkets. In these areas, we will impose entry restrictions. For example, in certain wet markets, we will only permit entry on alternate days. And we will do this with a system based on your NRIC or your FIN number. Depending on the last digit of that NRIC or FIN number, you will only be permitted entry on odd or even days. So that's one example of a localized entry restriction that we will start with wet markets, and we will do this also in other popular areas like supermarkets in order to thin out the crowds and reduce transmission risk in these areas. Third, we will close more workplaces and also tighten the list of essential services that are permitted. I mentioned this last week, and we are now ready to make this move. This is important because when we analyzed the local infected cases that occurred after the circuit breaker, many of them have been working as part of essential services or have family members who are working, because these are the people who are still out and about. We do need our essential workers. We appreciate their contributions, but we have to reduce the numbers who are working. And that's why we will make a move to cut back the workforce who still have to commute daily from the current 20% to 15%. And we will do this by making cuts across all sectors of the economy, but also in businesses that are consumer-facing, including in F&B and other services. So this will mean that all of us may face some degradation of services, or we may not be able to access F&B or certain services that we have become accustomed to. And I hope everyone understands why we need to make this important move. So overall, we are seeing results from the circuit breaker, but we cannot let up now. We have to make this strong push to decisively break the transmission chain. The measures that we've just announced will be in place till the 4th of May. Beyond that, we will continue with the circuit breaker for another 4 weeks to 1st of June. Depending on how the situation evolves, we will adjust the measures, and if there are clear improvements in our community transmission numbers, for example, if we see community numbers coming down to single digits, then we can consider gradually easing some of these measures. We've said from the outset that this is a prolonged fight, and we thank all Singaporeans and all residents of Singapore who have risen to the occasion and done their part through this circuit breaker period. Let us all continue to go all out to stamp out the virus and overcome this together. Let me just say a few words in Mandarin. 病毒阻断措施实行至今已经2个星期，我们已经开始看到一些成效。我们需要继续努力，再加一把劲。首先，大家必须在减少活动，留在家里，因为这是阻断病毒传播的最佳办法。如果你需要购买食物或日常用品，自己一个人出门就好，不需要用全家一起出去。如果你需要运动，也自己一个人就好，而且应该在自己居住的邻里范围运动。我们将会继续针对多人聚集的地方进行管制，像是斯巴萨和超级市场，这些地方将会有人流管制。如果你需要上巴萨和超级市场，最好是选星期一到星期五，人比较少的时候。另外，我们也进一步减少必要服务的种类，继续减少出门工作的人数。我们非常感谢必要服务领域员工在这段期间的贡献。我们将确保继续开工的员工保持安全距离，以及采取必要的防范措施。我们虽然开始看到成效，但绝对不能松懈下来，所以我们决定延长病毒阻断措施直到6月1号。我们将会持续观察情况，按照事态的发展调整措施。如果病毒传播的情况有明显的好转，我们会考虑放宽某些措施。要成功对抗病毒，除了站在前线的医护人员，也需要你我的努力。我们希望大家都能遵守阻断措施，让我们早日打赢这场仗。谢谢。
Good evening. I'd first like to provide an update of the situation in the dormitories. Previously, at the last virtual conference, I had sketched out our overall dormitory landscape, as well as the three-pronged strategies and the 3 key enablers for us to effectively implement the strategies. One of the key enablers are the forward assurance support teams, FAST teams. FAST teams have been deployed to all 43 purpose-built dormitories, and we have further raised another 26 teams to also look after the factory-converted dormitories. The medical posts have been up and running in all 43 purpose-built dormitories. In addition, we have also assembled mobile medical teams to support the factory-converted dormitories. And all in all, about 10,000 essential workers have been transferred out of these dormitories and have been relocated. They are now staying separately. Throughout this period, we have gotten the very strong support of the migrant workers themselves living in the dormitories. They understand the need for these measures and they have cooperated, for which we are very thankful for. Here, I also want to acknowledge the contributions of many non-governmental organizations who have stepped forward to volunteer their services and partner with the Joint Task Force in reaching out to the migrant workers and to support them during this difficult period. One area which has been particularly helpful is providing emotional support through assembling a team of counselors that are available to discuss with the workers any issues that they might raise. Now, because of the scale of the operations, this remains a very challenging task. However, we will press on, focusing on the workers' well-being. Now I would like to talk about some further measures that we will take in the dormitories. Prime Minister Lee earlier had talked about the situation when workers continue to move in and out of the dormitories. And when they do so, there are potential channels for cross-infections in both directions. We have completed the pull-out of the essential workers and housed them separately. And so we will now require all the workers staying in all the dormitories to stop going to work. This was something that we had planned for, and now we are going to implement it. Now, this new condition applies to workers from all companies, including those that have earlier obtained exemption to operate, but which MTI will now notify to suspend operations for this period. We know that there are going to be some adjustments to be made by the companies, but we seek the cooperation of both the employers and the workers on this new condition. It is a necessary measure to minimize the risk of transmissions. I also want to add that with Ramadan around the corner, the Interagency Task Force has coordinated with caterers and the purpose-built dorm operators to provide timely pre-dawn and breakfast meals. This is very important to our Muslim friends, and we want to make sure that they are properly taken care of when Ramadan begins. The task force has also translated MUIS Ramadan Guide 2020 on religious observances to take into account the safe distancing measures. And this will provide guidance to the dorm operators on how to facilitate Ramadan religious practices. MUIS has also come in to develop videos for religious guidance tailored to the workers' needs. We're very thankful to MUIS for this very important partnership. The third part I want to cover is on the stay-home notices for workers in the construction sector. We decided to do this because contact tracing efforts suggest that the transmissions at common construction work sites may have contributed to the increase in the numbers of infected workers. So this is something that we have taken as an added precautions, and during the period of the stay-home notice, enforcement officers will conduct regular and random checks. They may make phone calls or send SMS messages to the affected workers and require the workers to respond to these messages or phone calls. We hope that the workers will respond in good time so that we can also check on their well-being, whether they are getting the support that they need, whether it is for food or for other items, particularly on healthcare. Now, because of the circuit breaker measures already in place, frankly, we are seeing very good cooperation from the workers that are affected by the stay-home notice as well as their employers. We're very thankful to them for understanding the need to implement this precautionary measure in a very quick fashion and for making the necessary adjustments. I think if we were to be able to follow through with this, work stoppages, together with the closure of shopping areas, socializing areas, and coupled with the measures taken at the dormitories, we have a real chance of breaking these channels of transmission and a real chance of overcoming this hump in order that we may slowly bring back the recovery measures. That's all I have today. Thank you.
Thank you, Josephine. Now, let me now elaborate on how the government will help our businesses and workers cope with the extended circuit breaker period. We understand that the enhanced measures and circuit breaker extension will have a significant impact on businesses. To support our companies and workers, we will extend key support measures in the solidarity budget into the month of May. I will extend the 75% wage subsidy under the Jobs Support Scheme to all sectors for the month of May. I urge our business leaders to do your best to retain your workers and make full use of the various grants for training and other schemes for upgrading corporate capabilities. I will further enhance the Job Support Scheme to include certain groups of shareholder directors. These are employees of a company who are also shareholders and directors and who missed out on both the Job Support Scheme and the Self-Employed Income Relief Schemes. I will also waive the foreign worker levy due in May and provide employers with another $750 in foreign workers levy rebates for every foreign worker in employment. Families whose breadwinners have lost their jobs can apply for the COVID-19 support grant from 1st May 2020 and the Temporary Relief Fund. The extension of the solidarity budget will cost $3.8 billion. To conclude, in the months of April and May, this will be a test of our resilience as individuals and as a society. We cannot be certain when the crisis will end, but what is certain is that we are here for you and we will support you. Our healthcare and essential workers are central to our response to COVID-19, but the rest of us can do our part by staying at home, by encouraging those on the front line, and by helping the vulnerable and those around you. This is the spirit of Singapore Together. The coming weeks will be even more critical. I urge everyone to keep up this spirit of unity, resilience, and solidarity. As long as we stand with one another, we will emerge from this crisis stronger. Let me now say a few words in Mandarin. 总理刚宣布，阻断措施执行期将延长4个星期，这会带给企业和员工很大的压力。为了保工作、保企业，我们之前给予企业和员工的援助也将延长1个月。我们将在5月份把雇佣补贴计划的薪金补贴比例维持在75%。这将同样涵盖所有行业。我们还会扩大雇佣补贴计划的范围，涵盖一些符合条件并担任公司董事和拥有公司股权的职员。为帮助聘请特工的企业应付人力成本，我们将豁免多1个月的外劳税，同时继续提供额外的外劳税回扣。从2020年5月1日起，失业国人也可以申请冠状疫情薪金补贴，每月获得800元的补贴，为期3个月。这是非常时期，全民居家防疫，考验了国人的毅力和社会的韧性。每位国人现在都站在抗疫的前线上，我们要做好本分，不要慌，不出门，不乱传，为病疫尽一份力。这样一来，我们才能同舟共济，保健康、保工作、保企业。谢谢大家。
Thank you,
now-
panelists. Thank you, panelists. We will now begin with the Q&A. Media agencies, please use the raise hand button if you would like to ask a question. May we have the first question from Timothy from Straits Times?
Hi, thank you, Ministers, DPM. I'd like to ask, foreign workers are being tested very extensively here. So why is this not being done in the community? And would many more cases surface as a result? Do we not have enough tests and reagents in order to do this? And also, given that we are now seeing increasingly tightened movement control measures, possibly even at wet markets, supermarkets, are there any circumstances under which ordinary people, those not under stay-home notice or quarantine, will not be allowed to leave their homes at all, even to buy groceries or food? This is because, every time there's this announcement, we see big numbers of people flocking to the supermarket to panic buy.
Sir, can you repeat the last part of your question about?
Sure. So this is because every time we see an announcement about new measures, we always see large numbers of people flocking to the supermarket to stock up because they're afraid they won't be allowed out. So can we get some reassurance that people will be allowed out no matter what?
Okay.
Thank you.
We're allowed to go out.
We will continue to conduct tests and screening for Singaporeans and for our foreign workers, but we do it in a very strategic way, focusing on the objective of the test. In the dormitory, for example, in the cases where we have a higher level of prevalence, we want to test them in the first instance to give us a better understanding of the general level of prevalence in the dormitory, so that we are able to establish the baseline, what is the prevalence level in the dormitories. And from our general surveillance, we also have been able to identify dormitories which have higher prevalence and dormitories which have lower prevalence, and some dormitories actually do not have any case at all for the time being. And therefore, our approach, our strategy in dealing with different dormitories of different prevalence levels will also be different. So therefore, it allows us to determine what approach we should take with respect to the different dormitories based on the prevalence levels in these dormitories. And we also use these tests to identify positive patients so that we are able to provide the necessary medical attention for them. Whereas in the community, because every Singaporean is in a community, we have millions of Singaporeans, we will not be able to test every one of them. So even in the community, we do targeted testing. For those who are continuing to work, for example, we also will test them to make sure that they are not infected while they are going to work. But of course, we will not be able to test them every day, and therefore we do targeted testing as well, especially when they are being brought out, the essential workers, they are being brought out from the dormitories and separately accommodated, like Minister Josephine mentioned just now. We test them to make sure that they are not infected, and we will continue to test them regularly because while they're in the community, there's always a risk for them to be infected. But for the general population, I think the best strategy is really to stay at home. If you are able to stay at home, minimize the contact, minimize exposure in the community, then the risk will be significantly lower for getting the infection. And therefore, if your risk is significantly lower, then the testing will not be meaningful or effective. So I think that therefore, we need to make sure that our testing is always very targeted, very strategic, and serves a specific purpose. And at the same time, we are also continuing to ramp up our testing capability and capacity so that we are able to be more effective in detecting cases. And in addition to the these COVID-19 testing screening programs, we also have a surveillance program, what we call Sentinel Surveillance. As I mentioned in my opening remarks, these are surveillance programs that we do random testing in the community. The idea is to pick up cases that would otherwise have not been detected because they are either mild or they don't see complained about possible COVID-19 and they do not have case histories, and therefore, but we still test them, and we have been able to pick up a few cases, and these also reflect the fact that there are underlying cases they are transmitting in the community, and that is why we need to put in extra efforts in these circuit breaker measures to make sure that we are able to bring down these community cases, particularly those that are unlinked. This way, we will overall generally reduce the risk of transmission in the community.
Can I just respond to the question on whether or not people can go out? And just to be very clear, we are mindful that some people do have difficulties being isolated at home and being cooped up at home for long periods. It is genuinely difficult. It can lead to social, emotional difficulties, and which can all impact on people's well-being and health. And that's why we do allow people to go out for essential activities. What we are saying is when you go out alone, do what you need to do, run your errands, buy your food and groceries, and then come back as soon as possible. Minimize movement as far as possible and avoid going out as a family, even if you are living together, right? Because if you go out in groups as a family, you end up with more movement, more likelihood of transmission, more risk. So overall, the best thing to do, go out individually and keep the movement to a minimum. The restrictions that we are putting in place at wet markets and supermarkets, it's not going to be done across the board. In fact, already under the circuit breaker, you do see that many of these places, the crowds have thinned out, right? So, but there are still a few supermarkets and wet markets which tend to be more popular, and these are the ones, particularly at certain times of the week or certain days of the week, they do tend to be more popular, and so we do need to pay more attention to these areas. And that's why in some of these more popular areas, we will impose the entry restrictions that I mentioned.
Thank you, ministers. Can we have the next question from Cheryl from CNA, please?
Yes, so Mrs. Teo, you earlier mentioned that you've seen more cases of transmission at the construction sites. Could that be the source of the surge in numbers at the dorms? Have we been able to, isolate that as a reason for the explosion in the dorms? And when can we expect a peak in numbers from the dorms? Secondly, also for the McDonald's case.
Thank you, Cheryl. Now, the epidemiological findings does provide us with some preliminary clues. We are very keen to understand how the transmissions amongst our migrant workers came about, because we really do want to stamp out the transmissions, and this will be important going forward as well. Now, if you recall, from January to the middle of March, the cases of infected migrant workers were few and far between. And then sometime in the middle of March, they started popping up around the same time in some dormitories, not in all dormitories. The contact tracing does suggest that the migrant workers, although they lived in different dormitories, they had common work sites. And if you look at the pattern of their socializing during the rest days, there are certain areas that they frequented. And these were also the same places that they went shopping. So the measures that we are taking at the dormitories today have to be taken together with work stoppages as well as the closure of shopping areas. We think that the areas where the transmissions can occur actually can amplify the effect on each other. Because if you go to work at the same work site, but at the end of the work day, you go back to different dormitories, and if a transmission had occurred at the work site, then in fact, it wasn't just where the original infected workers were staying, it will be to other dormitories where the transmission had previously not occurred. Now you can extend this to also include the places where our migrant workers are very likely to socialize. It is part of human nature to socialize, and there's nothing wrong with socializing. But every activity that brings people together is also an opportunity for the virus to spread. And that is what we are learning about the virus. It spreads very easily through all kinds of human contact. And whether it is the workplace or places where we live or places where we socialize, these are all areas where transmission can occur, And if we really want to break the chain of transmissions, we've got to intervene at all of these places.
Thank you, Minister. Can we have the next question from Stefania from Financial?
We were listening to the COVID-19 multi-ministry task force. The press conference is still going on, but you can view it later on our YouTube channel. Now, the government will be extending the circuit breaker by 4 more weeks, and that means instead of ending on May the 4th, it will now last until June the 1st. So let's bring Professor Teo Yeking, the Dean of the Salisbury Hawk School of Public Health at NUS, into the conversation. Professor Teo, the circuit breaker will be extended until June the 1st. When you were last on the show, you said that it should be extended by 2 weeks. So what do you think of the 4-week extension? Is it a case of the longer the better?
Well, I think over here we have to see this is aimed at a prudent decision, because when I suggested to extend by 2 weeks, I mentioned it very clearly that we have to look at the data, and that was 1 week ago. So now we have additional information from the week that has passed. And looking at the information, there are 2 pieces of information that we know. Firstly, the circuit breaker has been effective. We have seen a reduction in daily case numbers when we focus on the community transmission, those that are not within the dormitories. Secondly, even though the numbers have come down, it hasn't really come down to the level that we were hoping for, because after 2 weeks, we would be expecting some of the transmission in the community ought to have stopped. And based on some of the information that we see from the daily counts, some of the actions that are taken, particularly around the closure of McDonald's, as well as the closure of the construction sector, we see that the essential services are part of the reason why there are some leakages that are continuing, seeding transmission in the community. So this is the reason why, even though the circuit breaker has been modestly successful, we still need to keep going at it and to extend it further. So rather than 2 weeks, it is prudent, better for businesses to plan with the perception that it will be happening for 4 weeks now.
Well, I believe it was Minister Lawrence Wong who said that if the government sees community numbers coming down to single digits, then it can consider gradually easing some of these circuit breaker measures. So, but do you think this is the best indication, or should we be stricter about this?
So, using the numbers, I think it is very important to highlight that it is always not just about the numbers on its own. So Minister, when he used the numbers as an indicator, he made it very clear. It was not just a case of numbers coming down to perhaps single digit, but also including the unlinked cases that are happening in the community. So there are multiple factors that at their level, they actually have the data and the information to be very clear where the cases are coming from right now. And based on those information, this is where they have to take the necessary decision. It is not easy, because it is not easy to now come after 2 weeks to say that we have to extend for a further 4 weeks. So just to make sure, this is not saying that the circuit breaker will end 4 weeks from now. It means that we are adding on an additional 4 weeks after the 4th of May. So we will end on the 1st of June. It is not easy for the government, for policymakers to come online to say that now we need to extend the circuit breaker. There is significant impact on businesses, on workers, on livelihoods. But the clear message here is that it is a very prudent measure that is necessary to protect health and lives. And that is the message that I got, that health and lives come first. We look after that first before we think about the economy. And I think this is where DPM also mentioned very clearly. There are additional fiscal support to help to look after the livelihoods of people. So I think that is the message that I got from the multi-ministry task force, as well as from the Prime Minister.
I want to focus on a specific measure that was brought up in the press conference. Minister Wong said that in certain wet markets, the public will only permit the government will only permit entry on alternate days based on the NRIC or your FIN number. So they're going to start with wet markets, and maybe they will implement that in other popular areas. Do you think wet markets and possibly supermarkets are the best venues to pilot this measure?
So if we look at which places right now are the public most likely to congregate at right now, because we have been told very clearly, you leave the house only if you need to get your groceries, if you need to get medicine, if you need to get food supplies as well. So from that perspective, we will see very clearly wet markets, which is very much of the culture among Singaporeans, will be one area where people like you, me, our parents will be going to. And because of that nature, we need to put in place measures that will help to thin the crowd. And given that people are very likely to try and come together, go to the wet market at about the same time to get the best ingredients, the best freshest fish and meat, by putting in place this measure based on the NRIC, it is trying to thin the crowd as much as possible by telling people, today is your slot to go to the wet market. You go now, otherwise tomorrow it is not your slot. You have to find maybe 2 days later before you go again. So those are very important messages aiming to thin the crowd. Wet markets in the first instance, and potentially maybe extended to other supermarkets as well. Those are the places right now in public where there are more people coming together, and the nature of the activity actually means that people necessarily are closer together.
Right. Well, let's turn our attention to the foreign worker dormitories. Minister for Manpower, Josephine Teo, said that all the workers staying in all the dorms will stop going to work. And this new condition applies to workers from all companies, including those that had earlier obtained exemptions to operate. But the Ministry of Trade and Industry will now notify to suspend operations for this period. So what do you make of this? Will it lead to a dramatic drop in the infections in the dormitories?
So we have to be very frank about this. Now we tell our foreign workers not to go to work. The impact is that it is likely there will be a fall in the transmission across different dormitories. So worker A from a worker from dormitory A will now not have the opportunity to interact or to spread the disease to other fellow workers at the same site from other dormitories. So this cut the transmission across the dormitories, which is a very important thing. Right now, Singapore has gazetted 18 dormitories. There are other dorms out there, then equally, there are other non-dormitory foreign workers out there. So we need to find a way that we don't have more dormitories being affected. So this is the first. Secondly, when we tell people that you don't work, the reality is that now these workers are in the dormitories for a much longer period of time. Previously, they'll be outside working, so the interactions within the dorm is usually during the evenings and nighttime. But now you are putting everyone within the dormitories. So this is where I'm at least very gratified that the multi-ministry task force have made it very clear. When we expect the dormitory workers to stay in the dorms, at the same time, we know that there will be some additional spread within the dorms. This is the reality. Measures are taken to try and minimize this spread, and equally now there are an enhancement of the medical care and support at the dormitories itself. So the dormitory workers will expect that if they are ill, they will be able to get access to medical care as early as possible, including if the symptoms worsen, they will have medical attention to the hospitals as quickly as possible.
Right. Let's revisit something that you were saying before PM Lee's address. We were talking about whether you expected the majority of the foreign workers who are infected, their ability to fight off the virus. So could you continue that answer? Do you believe that the majority of them will be able to recover?
So let's look at what we know about the disease from countries that have been very worse affected by this condition, by coronavirus. In China, in South Korea, in Italy, in Spain, we see the data very clearly. People within the age group, typically from 20 years old to 50 years old, those would be the majority of the migrant workers that we have in Singapore. That's the age segment, 20 years old to 50 years old. The severity of the coronavirus infection in this age group is actually much, much lesser. So what this means is that even though we see very frightening numbers like 1,000 dormitory workers being infected every day, what we expect is that a very small fraction of them will actually progress to a stage where they need maybe intense oxygen treatment. So the vast majority of the migrant workers will actually have very mild symptoms. And I think this is the silver lining amidst a very gloomy situation right now. And because of that, we must calibrate our national strategies accordingly. And this is where, based on today's announcement, we have seen that some of the foreign workers that are affected, they will now be housed in special blocks within the dormitories itself, with an addition of medical attention and medical teams that will provide the clinical support for these foreign workers.
Right. I guess on the note of a silver lining, let's look ahead. When the circuit breaker eventually lifts, whenever that will be, which measures do you think will be eased the first?
So it's quite interesting that the measures will actually last until June. Because again, I will come back to what we know about the disease. What we know about the disease is that actually children are very unlikely to suffer very severe consequences. The data right now worldwide suggests that actually children are least likely to be affected by the coronavirus. And those are information that we use not just in Singapore, but governments worldwide are looking at this data to decide what are the measures to take. So actually, one of the easing was actually schools, that there are strategy documents from other countries, including European countries, including America, that talks about how schools can potentially be amongst the first to open because children are at very low risk. But because now I mentioned it is interesting, it is June, because that ties in with the June holidays. We will need to see whether there is any clarifications where, because of the additional circuit breaker, there may be schools that need to come in for children need to go back to school a couple of weeks in June. So I think that is something we will wait for the Ministry of Education for further clarification. So schools is one. Actually, on the other hand, there will be other sectors that we are very clear that can be relaxed. For example, some workplaces can resume first, but the vast majority are actually on this telecommuting work. And this is where we need to properly evaluate what are the sectors that can continue a telecommute model, meaning even after circuit breaker release is eased, most of these people will still work from home. Equally, for food and beverage outlets, we need to look at perhaps the takeaway model will still remain. Dining in may still not be allowed for an extended period for a while more. So there will be certain measures that can be eased, certain measures that will still have to remain. And I see that as a necessary strategy when countries, not just Singapore, start to plan what do we do after easing this circuit breaker model.
Right. Well, thank you as always for your time, Prof. I've been speaking to Professor Teo Yik Ying, Dean of the Saw Swee Hock School of Public Health at NUS, and he'll be joining a special panel discussion tomorrow with our senior health correspondent, Salma Khalik. Join her and a host of top infectious diseases experts as they discuss how new information about the pandemic is guiding Singapore's response, as well as the rise in dormitory cases. That's at 5:30 p.m. tomorrow. Be sure to catch it. Now, Deputy Prime Minister Hsien also said at the press conference that key measures in the solidarity budget will be extended to May, including the 75% wage subsidy under the Job Support Scheme for all sectors. The full press conference will be on our YouTube channel, and you can also visit straitstimes.com for all the details. I'm Olivia Quay, and stay safe, everyone.